Thank you, Kate, and the last group of panelists for the wonderful conversation. I'd now like to turn to this wonderful group of panelists to discuss AI and data through the lenses of ethics and privacy. So with me is Dr. Katherine Blizinsky, who is a policy director at the NIH All of Us program. That is an effort to gather and study the health data of about 1 million participants. And we also have Dr. Tina Hernandez-Boussard, who is a Stanford University Associate Professor of Medicine, Biomedical Data Science, and Surgery. I'm so glad to have both of you here today to provide some insight about this ever-changing issue. So let's jump right to the first question. I wanted to ask you two about your background in ethics and privacy policy, and perhaps a little bit about, based on how your work goes, how should we, reconceptualize policy and usage of AI and data in terms of privacy and ethics? Dr. Blizinsky, do you want to get started?
Oh, you're okay.
Yeah, go ahead.
Well, I'm sitting here next to Dr. Hernandez-Boussard. I feel a little bit like a dilettante here. So I am going to say that I am very much a generalist, and my concern is really very broadly over the policy implications of the larger research project. And so I dip my toe into a lot of different pools. But certainly, the study of ethics is something I started way back my first round of college, and has been a common thread throughout both my educational and professional careers, and has sort of culminated in my role now with All of Us, where I head up policy and ethical, legal, social implications work for that initiative. Dr. Hernandez-Boussard, do you want to talk a little bit about your background as well?
Sure, yes. So at Stanford, I lead a very diverse lab focused on medical informatics. We use all different types of patient data, including patient data from our hospitals. We use data from insurance claims. We capture registries, et cetera. And then we use that data to try and create insights for clinical care. Over the past several years, we've been looking at, what's the evidence we're gathering, and who is part of this evidence? And that's where we see some of the important issues emerging to the top of some of our research in regards to sort of the equality and equity of using this data to help guide clinical care. And a lot of the policies that we use to guide our data use have been around for decades. So in particular, I'm thinking about the HIPAA policy, which protects health information for participants. And I think that now that we're moving into AI, a lot of these policies need to be reevaluated, right? When HIPAA was created, we weren't at this point where we're buying and selling data to try and develop precision medicine, individual prediction levels, et cetera. And so I think we're at a point right now where we really need to think about, what are these existing policies and how do they fit with our data sharing and data usage today in relation to AI and precision medicine and all of this information, and where can we make substantial changes? And I think there are needed changes in these policies to accommodate our current state of science.
Right. And, just building off of that, I want to look to the All of Us program, and it's pretty nascent in what it's doing. And, Dr. Blizinsky, do you think you could talk about the policy that you've been crafting there, or have already adopted at All of Us, in terms of, how you're trying to drive forward mission while also protect that data that, you're handling?
Sure, I'll give it a shot. I think that one of the really crucial aspects of this is that it's not a single policy, but many different interlinked policies. And that's actually really critical, because it's not like there's going to be any one policy solution that's going to suit all of the needs. And it's not going to be able to grow as effortlessly with technology and with discovery. So we've sort of taken that attitude towards it. And of course, one of the things that's always sort of at the forefront here is that we want to ensure that we don't betray the trust that we've brokered with our participants, their well-being, which includes their privacy. really needs to be the first and foremost of our concerns, which is why we've chosen by policy decision to bring ourselves into compliance with things like FISMA moderate standards of security. And we're also working on expanding that to privacy controls as well. But we've also approached this from the frame of mind that the data is not a scarce resource, and the more that it's actually used, the greater potential good that it can do that come out of that. So, and then there's also the aspect of like, this is a time when we actually need more cooks in the kitchen. We want to expand and broaden access to make sure that we're hearing from different voices, that we're approaching problems from different perspectives. So that's really led us to think about access as challenging that traditional posture of really thinking about, you know, approving somebody for a particular type of proposal, and thinking in terms of data passports where data users themselves are the approved party. So it's thinking about who's using the data, not necessarily exactly what they might use it for, but also thinking about making sure that we can monitor the use of that data throughout the process of use. And it starts, there's also aspects that we want to make sure that we're ensuring we're clear with researchers about their expectations and our expectations of their conduct, which includes policies around preventing stigmatizing research and communicating research findings in ways that preserve participant privacy. There's aspects of accountability where we've codified our expectations in our data user code of conduct and our data use agreements. That are binding contracts that extend liability for misuse, not only to the researcher, but also in some cases to the institution from which they come from, and also supporting researchers through the process of their research. So providing them with resources to ask questions on LC and logistical guidance, to preempt some of that use and also heighten awareness of the responsible conduct of research. And then there's oversight, of course. So everything from the structure of the data, researcher interaction, and moving the actual analysis to a secure enclave, which allows us greater visibility into researcher activities, to random workspace audits, wherein we very carefully scrutinize what's being done in each of those workspaces. So that's kind of how we've approached it. It is definitely still in its experimental phases. We're monitoring our approach to see if that's actually working out, and we're open to changing it if needs be.
Definitely. And, you know, just as you were saying, there's so much data out there that we really need to get a handle on, and getting that balance between progress and protection is such a touchy issue, but is also really critical to get a handle on with everything going on in the science realm. So, you know, NIH sort of just launched its Bridge to AI initiative to sort of advance AI in biomedical research, and it's really becoming a bigger issue and something that everyone in the science realm sort of wants to, you know, leverage. But how do we reach that balance between innovation and protection and using data, especially in, you know, the field of medicine, which tends to use people's very personal sort of health data? Dr. Hernandez-Boussard, do you want to start?
Yes, sure. So this is a great question, and really what we need to do is we're trying to balance privacy and equity, and how we can do that, which is challenging, right? Because there is some sense that, you know, the more open we are in describing information, we're hindering innovation, right? So if everyone has to report on every detail about their model development and what's going into their model, how, you know, what trade secrets can we keep, et cetera. So that's a really important balance that we need to think about. However, you know, there is this important term that was mentioned, and that's trust, right? So the patients have to trust the system. And unfortunately in healthcare, we've seen a lot of instances where that trust has been broken for certain populations. We see that, you know, data are being misused. We see AI algorithms that benefit one population and maybe exacerbate disparities in other populations. And unfortunately, this is because of our historical bias in, you know, how data are collected, who has access to healthcare, how the data is being annotated and created. And so when we're developing these technologies, we need to be very sensitive to that information. We need to be very sensitive to the types of data that we use in these algorithms, who it represents, and how we can do a better job, I think, being more open and transparent about the inconsistencies in the data, about the biases in the data. The data is what the data is, and any AI algorithm is going to learn from the data we have. So being transparent about these issues with the data and where it's coming from can allow people to make important decisions regarding the appropriateness or the applicability of these tools to different populations.
Yeah, I want to build off the topic of equity and bias prevention there, but before I do, I want to give Dr. Blizinsky the chance to answer the question as well.
Sure. I think I would just double down on what Dr. Hernandez-Boussard said, and I think that this is, we don't have a definitive answer to this question yet, but it probably starts with building some very clear boundaries around acceptable uses, and critically, those boundaries need to be informed by more than just the views of the research community. We need to consider and actively consult groups that could be disproportionately and negatively affected. And that includes social and cultural groups that are already subject to discriminatory practices, with an eye both to the sort of local, national, but as well the global. And that's an extremely tall order, but it is an imperative one.
Excellent. So jumping back to the issue of, bias prevention in AI and getting to more equitable AI as well, what role can diversity play there, whether it's, in developing AI or the data itself, or in preventing bias? And what are your suggestions, or what steps do we need to take to get to more equitable AI?
Yeah, I'd be happy to jump on that question. This is a very, as we all know, a very important topic. And right now, the way I see AI in healthcare is it's really the wild, wild west, right? There are no data standards. There are no set upon regulations for how we use data, how we report data, and really what makes a tool good enough to be deployed and used on patients. There's absolutely no standards right now in our community. Now, agreed upon standards, I would say, because every day we have a new set of standards, or every week we have a new set of standards coming out. But at a national level, we haven't had a consensus on really what these standards and metrics should be. So we've done a lot of work thinking about, what's the minimal amount of information we need to really be open to understanding how bias can integrate into our systems. And this is called the Minimar standard that we've developed and published on. And really what we're saying is we need to know information on where the data is coming from, what's the architecture or the technology being developed, what's the output? And a lot of times we use proxies for these outputs. And so are we modeling, cost of care, or are we modeling care need? And those are not good proxies for each other. But we've seen, instances where models are developed for one thing, but then applied for something else. So having a clear understanding of what these models are developing and how they should be applied to the system is really important. And also understanding what makes a good model, right? Because we don't know what makes a good model. Is it accuracy of 85%? Is it, precision of a certain percent? There's no real guideline for that. And I think, as Dr. Blizinsky was saying, it's not going to be one size fits all, right? It's going to be very unique to each individual cases. But I do think we need to develop standards on what is the minimal amount of information that we need, and what are our standards regarding metrics, and what type of metrics should be applied. And just one more comment on that. A lot of our models we develop are really, when we report them, we report on precision or accuracy. What we don't report on are these bias issues and clinical utility. And there's a huge gap in reporting that information. And I think the more we encourage and enforce the reporting of algorithmic fairness, data biases, clinical utility, the more we'll see the appropriate application and the reduction of bias for the use of these tools.
Right. Dr. Blizinsky, do you want to add to that?
Again, I think that Dr. Hernandez-Boussard has put it very articulately. The only thing I would do is extend that to making it a mandate as part of the policies that guide this work. And, you know, this is the time to use the big stick, right? So, yeah.
Yeah, absolutely, absolutely. Because you know, it's just there is no standards, right? And so interestingly, you know, the European Union has really made some important strides in this space. So they have the you know, they have information on, you know, explainability, on reporting of the use of your data in AI systems. And I really think it's time for the US to make a stance and to make a recommendation on some of these really important issues regarding these policies.
Right. I want to continue off of that and just, you know, ask you about some of your work there. You've been a big advocate, as you were just talking about, you know, getting to these standards and realizing ethics and privacy as we move forward in this era of AI. So based on, you know, what you've done, what kind of recommendations do you have that the country should adopt in developing these standards?
Right. And so I think this is a really important question. And as you mentioned, this is something we're really focusing on on my team. And, you know, I think there's important policies that need to be set, as we were just discussing, at the national level. So the FDA has some policies regarding software as a medical device. And those policies are really focused on image analyses for the most part, image analyses and radiology, tools for radiology. But they also have this important clause that they put out that, you know, they're looking at sort of their adverse events for individuals that are from medical devices, so the MOD database. And I think it's important we take a step back and say, you know, these AI tools are not harming an individual, they're harming entire populations. So we need to set policies that are going to really address how we can minimize these adverse effects on different populations. And so again, I'm going to go back to our MINIMAR standard that we developed, which is, you know, a standards for what needs to be reported before we can use AI in healthcare. And again, I think it's important to understand that no data is perfect. All data are going to have missingness, inconsistencies. They're noisy, and the more and more data we get, and we're getting patient-generated data, we're getting, you know, genomic data, we're getting healthcare data, we're getting education data. It's noisy and it's very difficult to use. So being transparent about the inconsistencies and the issues with these data are the only way that we're going to mitigate these standards. So I think it's really important that our regulatory agencies really take a stance on, you know, what are the minimum standards for performance of these algorithms? What are the minimum standards for inclusion of diverse populations? You know, does the population that was used to train these technologies really represent the population that it will be applied to? Or a lot of times in healthcare, what we see is the populations are coming from these academic medical centers that are really not representative of the entire US population. So tools that are developed to predict outcomes in this population, in the academic medical center population, might not be applicable to all other populations. And understanding that gives the healthcare team the power to know the best utility of these tools and knowing the appropriateness to apply these tools to different populations.
Right. And Dr. Blizinsky, you were talking a little bit before about some of the different ways we should reconceptualize policy. And, based on what you've done with all of us, you were talking about how we could move forward with reconceptualizing how we have access to data and things like that. So what are some lessons learned that you've gained from your work with the All of Us program there?
Well, it's early days yet, so I don't think we've had the opportunity to reflect enough to share, more global lessons learned. But I think we are in the process of learning how to create an environment of policymaking and program building that is much more inclusive, both from the public arena, but also from the researcher arena, and thinking about integrating those voices as part of the process of policymaking, and how to do that effectively, because you're not going to be able to ask every single person involved in every single thing what their opinion is, and you're not going to make every single person happy, but being able to address, as Dr. Hernandez-Boussard was talking about, the aspects of group harm, and how do we approach those group harms? How do we approach those communities and solicit feedback on making policies that make sense for them and make policies that prevent that group harm? And again, I think we are in the process of learning how to do that. But it is, I think, something that we need to be committed to if we're going to be successful.
Right. And well,
can I just build on that, because I think this is a really important point that Dr. Blizinsky is saying, and it's really about having multi-stakeholder involvement at every step of the process, right? Having these diverse populations with you when you're designing the question, when you're designing the algorithm, when you're looking at the output and the features associated with the output. If you don't have that diverse team throughout the entire steps, you're not going to know what you're missing. You're not going to know where these problems are. And having a bioethicist on board from the very beginning is something I highly, highly recommend, because they think about things differently than an engineer thinks about them, or differently than a clinician thinks about them, or a policymaker. And so really, I just want to reiterate what Dr. Blizinsky is saying, is that multi-stakeholder diverse group is essential to addressing this question.
Excellent. Back to Dr. Blizinsky, you were saying how All of Us is pretty experimental and just, getting its feet off the floor, whatever the saying is. What is, what challenges, I guess, have you faced in managing health data at your program, in terms of, balancing that openness and protection of data, or just general challenges that you faced in setting policy?
I think that one of the first and foremost ones is making sure that we do get the diversity of input, and in the process of decision making, having to move relatively quickly to actually execute what we're doing, but at the same time wanting to have that pace where we can solicit that important input and digest it and turn it into something meaningful. That's been one of our biggest challenges, and also reining in our excitement over new and shiny things, and making sure that we're staying on task, on focus, thinking about what is the priority here, who are we serving, and also thinking about the fact that we're not actually doing the research ourselves, right? We're providing a resource for a larger community. And so when we think about these things, when we think about like getting multi-stakeholder input, we can do that for our program, but how do we then carry that forward? How do we think about providing resources for the people who are actually going to be using the data to make sure they're doing the same thing? And we can set up some of those expectations, but we also need to make it realistic, because what we're talking about when we're talking about broadening access to the data is also bringing in people who may not have at their fingertips, somebody who is an academic ethics expert, right? But, we need to still be able to provide them with the resource that they can use to get that input, regardless of where they're coming from and how they're doing their research. So I think those are definitely some of the difficulties we encounter. And then also just negotiating differences in expectations on what's going to be done, how it's going to be done, and the freedom with which people will have access and be able to use the information. So when we think about, enfranchising people who want to use technologies like AI, How do we set appropriate guardrails, to use the term? How do we do that? How do we set that up from the beginning of the program to ensure that we're being as cautious as we need to be to do our due diligence to protect the trust that we have brokered with our participant populations. So yeah, I think that's going to be an ongoing struggle, but again, it's something that we need to think about if we are going to measure any kind of success.
Dr. Hernandez-Boussard, does that resonate with you at all? Do you face challenges like these in, your work too?
Yes, absolutely. I mean, a little different though, because we are at an academic center, so we have access to, such expertise in every subject. So what's important is developing that collaborative environment. So while maybe like a group will come to me and they want to develop an AI tool to look at some type of patient outcome. And what's important is that we can foster an environment where we can, add on other stakeholders to the process and provide, a platform where other by the bioethicist or these patient panels can come in and really help form not only the technology, but the research question in itself.
Excellent. So I just have a, question or two left, but I just want to go back to the topic of the day, which is, data insights. So as researchers collect data and try to gain insights from it, or to develop AI, what are your recommendations for what they should be doing from their initial standpoints as they're, launching projects or developing policy? How can they be navigating these waters to build in ethics and privacy into their work?
Yeah, I can go ahead and take a stab at that question. I think it's a really important question because we are at this point where we are using data for insights, and it's so important that we use as much data as we can to better provide insights into where we're going in healthcare. And I think it's important when people are entering this field that they really think about the questions they're asking, right? And can these questions be answered with the data we have? And can they be answered with the technology we have? And the other point I think that is really important is we need to start thinking, we need to move from thinking of a quality of care to thinking of equity of care. And that might mean that, some populations might need more resources. Some populations might need less resources. So how do you think about developing an AI tool that's really going to address equity, meaning equal outcomes, equal endpoints, rather than something that is more around, ensuring that everyone has the same amount of resources. And so moving to that equitable outcomes and really thinking about the output, I think is key to how we move forward. And that will also drive your stakeholders, your data, and the actual technology and the implementation of your tool.
Dr. Blizinsky, do you want to add to that?
I would say that sometimes in science, we have the tendency to think of ourselves as above the social context, that we are, in the business of, to put it, business sounds, this is a dirty word in academia sometimes, but that, that we are, our jobs as scientists are to produce knowledge, to produce information that's useful, but we tend to think of that as outside of being part of society. And I think that, we don't have that luxury anymore, if we ever did. But that we need to take a step to acknowledge our social responsibility. And it's only the beginning, really, because dealing with the value implications of our work is part of the responsible conduct of research. We need to address the moral, the political, the social, and the policy issues that are at stake. And I think that a good start is to talk about it, to think about it, to engage with other scientists about it, to engage with other non-scientists about it, and especially thinking about it in terms of engaging with, again, with those populations that could be disproportionately affected by those downstream effects. So that's a very simplistic answer, but again, I think it's, it's an easy place to start.
Yeah, and that's a perfect way to end this panel and this event. There's a mountain to climb, but we have two of you and many others out there chipping away at this issue. So I appreciate your insight and the wonderful conversation we just had. And with that, I will pass the stage back to Michael Hoffman to close out the program.